Very good morning to everyone. Myself, Dr. Mohini Daltani, periodontist and implantologist and laser specialist from Navi Mumbai. So the topic for today's presentation is diode laser beam to benefits in clinical dentistry. So I'm the founder of my clinic, that's Advanced Orthopedic and Dental Care at Vashi. I'm a speaker at Elamid Academy and Academy of Advanced Endodontics, Bangalore. So to begin with laser, to start, so in our dentistry, we are completely in the revolution phase. We are every day trying to get new materials where we want to have a better patient comfort and for our comfort too. As you could see in the diagram, initially we had all the manual chairs and now we have come up with the automatic chair. Initially, we had black fillings and now we have come to white cosmetic fillings, absolutely tooth colored. And the black fillings are outdated and not even banned right now. From painful to painless extraction, from drills to no drills, from painful to sedation dentistry. Now we are a lot of us are using cautious sedation so that patient is completely at comfort level and it can add up ease to the procedure from blood filled site to bloodless site. So the bloodless site is completely dependent and is possible because of lasers. So lasers are boon to dentistry. They ideally add a light to our dentistry. But do you wonder how? Do you feel it's a magic wand? Absolutely not. Why is laser unique? It's because of its unique qualities and its synonym it stands for it. That is light amplification stimulated emission of radiation. So let us see how your laser light and ordinary light is absolutely different. How is that the laser light is very unique? So to begin with, as you could see, the ordinary light is polychromatic. Polychromatic means you have multiple wavelengths in that. But whereas in laser light, it is completely monochromatic. Monochromatic, it's only involving your single wavelength. Mono is one, chroma is color. So that single color wavelength is used. Next, ordinary light is emitted in many directional, but your laser light is completely unidirectional. No, laser light are non-coherent. Ordinary light is non-coherent, whereas your laser light is completely coherent. So what does coherence mean? The waves that are coming out are in space and time and are in equation with each other. Next, the laser light is collimated. Collimated, the beams that are coming out of the laser light are absolutely parallel with each other, whereas the ordinary light are divergent. So if you have to sum up completely, how would I say? Laser light is monochromatic, coherent and collimated and is also unidirectional. So that are the unique qualities of your laser and that's the reason it stands out. Now coming to your amplification, so everyone knows this atom and it's your nucleus. As you could see in this diagram, this is an atom that consists of your nucleus and orbiting electrons are there in the shells. So whenever a photon is hitting up the nucleus, what happens? Electron absorbs the photon and it goes to the higher state. So whenever it is in higher state, it is always unstable. And when it wants to come to the ground state, in that process, it emits a photon. So that is called as your stimulated emission, where your photons keep on emerging and emerging. So to understand that better, we could property. As you could see in this diagram, this is the laser machine. So you have an optical pumping cavity and you have a laser medium. Laser medium could be a solid, liquid, dyes or gas. And this is your energy source. This is to complete reflective mirror one side and one is partial reflective mirror. From this partial reflective mirror, I have a shutter from which the laser light comes out. So your energy source could be either your light or flash lamp. So once the energy is started, you give the energy to the laser machine. What happens? That photon that is generated is absorbed by the electron and then it starts emitting more and more photons. So once it goes to higher state, it is unstable and in that process the photon is hitting up again. So that emits your two photons. So that is called a stimulated emission, right? So in that process, these two photons again bombard with each other to form 4, 4 forms 8, 8 forms 16 and 16. That is how the number goes on increasing. That property is called as amplification. Amplification is that it keeps on multiplying and multiplying. So that is how, as you could see, once it starts and because of this optical cavity and you have completely reflective mirror, the photon keeps on bombarding with each other. Once they're bombarded, they come out, and here that is how the laser light is emitted in a narrow beam. What is stimulated emission? Emission refers to the giving of photon. So as I have told you, once the absorption is there, whenever you give an energy from ground state, it goes to the higher state, that is absorption. In higher state, it is unstable and it wants to come back to the ground state, and it emits one photon, that is called as spontaneous emission. But what happens if it's in higher state and it's bombarded with one more photon? It will emit your two photons. So that quality is called as your stimulated emission. Okay. So now coming to the next quality is radiation. So what is your radiation? Radiation is a photon that is coming out from an atom. So as you could see this, you have this is the complete laser wavelength presented graphically. Anything below 350 nanometer is invisible ionizing radiation. Between 350 to 750 is your visible radiation, and above 750 is your invisible thermal radiation. Right. So what are the indications of laser? Where all I can use laser? I can use it for incision, excision, ablation to accelerate my healing, and for the bacterial reduction. So these are the main indications of your laser. So let us have a look one by one, clinical term, branch wise, how it helps us. In endodontics, very commonly that we use is your disinfection. We try to do it with sodium hypochlorite, but even that does not add up. It does not completely gives you a complete clearance that now I will not have pain. So how does laser helps you? Laser is acting as a disinfectant and as an antibacterial. So whatever process you do, so laser will be used as an adjunct so that you get a very good result. As you could see in this diagram, so once the AO is done, BMP is done, you have to keep the canals completely wet. And once the canals are wet, you could see I take a laser tape and it is not activated, not initiated, and you try to have that electrical motion from ground from apex to the corona direction. So you have to go slowly. So once that is done, and you complete your obturation, and then you can place the prosthesis. But what are the limitations with this laser? One such limitation is that it's very difficult to have an equal irradiation. And also one more thing, if you have a curved canal, your laser tips are straight. You can't use it in those completely curved canal. And you do not keep the laser tip in motion, you can itself create a ledge with the laser. So always remember, the laser is not recommended as an alternative to hypochlorite but as an adjunct to your hypochlorite for your complete disinfection protocol. Now coming to your periodontics in field, we have very common clinical finding, that is your mucosal. It's a painless regulated swelling that you have in your lower lip. So if you do the same surgery with scalpel, you'll have a lot of bleeding, right? So to avoid that, the laser is where you come into the picture. So this is how it looks immediately post-operatively. There is no bleeding. Patient is absolutely comfortable and fine. And this is how it looks. Excellent healing you have once the surgery is done. You will not even able to demarcate where the surgery was done. You could see in this diagram. So what is the last golden clinical tip for this? Always whenever you do laser, the tissues get adhere on the laser tip. So try to keep it clean with help of your wet gauze, right? Now next coming with the tongue tie. Tongue tie is very common clinical condition that you find in your period of practice. So what happens is when you have tongue tie, the tongue is unable to touch the palate and you have a very slurred speech. So that is where the laser is out. This is how it looks immediately after the surgery on third day, and you could see this yellowish thing, that is a protein coagulum. So protein coagulum itself acts as a periodontal dressing. That is also one more reason once I do laser surgery, I do not require copac anytime because I know I will have a protein coagulum form and that itself will act as a dressing. This is how it looked beautifully after the 1 week of healing, and this is pre-op and post-op, and you could see a very good, tremendous difference, right? But one more clinical tip I would like to say: whenever you plan to do your surgeries, always make sure you know the anatomical landmarks. Okay, it's not just easy to take a laser and cut the tissues. You have to know the anatomy. You have to have a proper clear anatomy of your tongue. You have deep lingual vein, you have submandibular duct opening on sublingual papilla, you have frenulum, you have sublingual fold. So make sure you know what you're cutting, and you should not harm the anatomical parts at all. Coming to oral medicine and radiology, people come with ulcers, so you can use laser in form of your low-level laser therapy. So zero point 0.5 watt is used, continuous wave mode for 30 seconds, and that is the beautiful result you get on third day. You don't have to use any gel. And once this LLT is given, the patient is like, "Oh my God, you have actually done it! I can't even believe." Next, coming to the ortho branch, how laser helps here. Mostly, whenever you do ortho treatment, you could see that there are gingival swelling comes up, and you get the pseudo pockets. Patient complains of your food lodgement, and so what? How does laser helps? We do laser. This is how it looks immediately post-operatively. There is no bleeding. Patient is absolutely comfortable, and this is the healing that we experience. It's actually very very nice and beautiful. So you could see this pre-op and post-op. The patient was super happy and we even debonded the case. Coming to the next field, that is your cross-treatment. Very commonly we do CLP. Posteriorly, you don't have height, clinical crown height, and you do crown lining procedure with gingivectomy. So as you could see this, there was a patient of who had complained of dislodged crown many times. So when we did a clinical finding, we found that the clinical crown height was less. So we planned for the crown lining procedure, that is just gingivectomy using laser. So this is how it looked immediately post-op. Once the gingivectomy was done, I could see the margin. I just redefined the margin, and on the very same day, I took the impression, and the crown was fabricated on third day. So that is the beauty of laser. You don't have that waiting period, or it's not like you have to wait to have that healing period for 1 week or 10 days. So what is the golden clinical tip? Always make sure you, while using the laser to treat the tissue, keep the exposure time very minimal. Coming to the next field, that's perio. That's one of my favorite because I myself am a periodontist. So this is a case where very commonly once you complete obturation, you have this gingival polyp and that adder that actually interferes with your margin prep or even the impression making. So laser, you can do just a gingivectomy immediately, and this is how you are able to see the margin, and you can take the impression on very very same day. This is a case where operectomy was performed with the help of laser and patient was super happy. Now the operectomy is done up, now patient is able to clean and it has no. So whenever you do operectomy, make sure you remove the distal pocket and you do not forget that. Coming to the next case, that is frenectomy, very commonly performed surgery in a clinical practice. So you have high papillary attachment. So what did we do? We initiated the tip. I used a continuous wave mode and wavelength was around 940 nanometers with 1.2 watt we started. So this is how it looks beautifully. Try exciting the fibers slowly. Make sure when the surgery is done, you have to test the tension test and check. Do you have tension test now positive? So this is how it looked immediately post-op. I didn't had any bleeding. Patient was super happy. This is how I plan to do low-level laser therapy. Why did I do that? To accelerate the healing process. I do it for all my cases once the surgery is done. So because the rhomboid shape that was done after post-operatively was too big, I planned to just give one suture at the labial mucosa. So once that was done, this is how the protein coagulum could be seen on very third day. Right? So this is how from papillary attachment we got back to. So this is your pre-op and post-operatively, and you could see the beautiful results. So this is the 1 year follow-up. As you could see this diagram, papillary, from papillary we came back to mucosal attachment. So make sure you do not aim for very wide rhomboidal area, and even if you have so, just try to make sure that you give one suture at that point. Okay, now coming to the next case is your vestibuloplasty. As you could see here, I've got high frenal attachment and the vestibular depth is less. So if my vestibular depth is less, I am not able to brush properly and the tension test was. So I did vestibuloplasty and I called the patient on third day and I could see this beautiful yellowish protein coagulum. And the result was very immediate. The frenum was not having now any tension. This is how it looked immediately after 1 month. As you could see the diagram, pre-op and post-op, you have increase in width of attached gingiva, increase in vestibular depth, and tension test was absolutely negative. So whenever you plan for vestibuloplasty, make sure you involve one tooth adjacent, nasal and distal both ways. So coming to the next case is my tongue tie case. This was a case referred to me where the patient had slurred speech and he was not able to pronounce clear words and he was not confident. He was around 30 years old guy. So we planned for surgery. You initiate the tip and slowly you try to release the frenum. As you could see, once the frenum is getting released, the tongue is now able to touch the palate. So this is how it looked immediately post-operatively. There was no bleeding and patient was super happy. He immediately went to the office once the surgery was done. So this is your low-level laser therapy after the surgery was done to accelerate the healing. This is your 1 month follow-up. As you could see, patient is completely able to touch the palate and the slurred speech had gone off. So coming to the next case, curettage. The patient had underwent many times cleaning but had no positive results. She was having continuously complain of bleeding gums and was not able to eat hot, cold or spicy at all because of those inflamed gums. What did we do? We did all the clinical findings. We checked it up. We had redness, we had inflammation, we had pocket. So we plan to give her oral prophylaxis, mouthwash and gum paints. Oral hygiene instructions was done once the scaling was done. So after for full mouth laser curita. So this is how she came to us after my oral prophylaxis. So once the curettage was done, so as you could see this video, you completely remove the infected pocket epithelium. This is how it looked after 1 week and this is how it looked absolutely after 3 weeks. So we were very happy to give her beautiful results and she was also super happy because now she was able to smile confidently. She had no bleeding gums and we had absolutely solved her problem. So what is the clinical tip for this? Make sure you do not heat up the papilla. Now coming to the next case is your depigmentation. It's one of the cosmetic procedure that is very commonly performed. So whenever you do depigmentation, make sure you have to be very concise. So you should know what are you doing depigmentation. It is from the mucogingival junction to your free gingival groove. So after giving anesthesia, take your laser tip, go in the paintbrush stroke and try to remove the pigmented epithelium. Once the pigmentation is removed, you could see those pinkish areas. So that gives very immediate result. This is how the immediate result was there and patient was very happy. This is the post-operative photograph after 2 weeks and this is your 1 year follow-up. So now the patient was understanding that the depigmentation surgery with laser helped me a lot. So if same surgery was performed with scalpel, yes, you would have observed one clinical finding, there would be lot of bleeding. So this is one more case of depigmentation, pre-operative and post-operative, where we have got very beautiful results. What is the clinical tip? Make sure whenever you do depigmentation, don't forget to check the biotype. It's very important. If you have a very thin biotype and you just try to scrape it off, you will end up exposing the bone, and that should not be the case. Okay. Coming to our last case, that is periimplantitis. It's a case where I had got high frenal attachment. I had a bone loss. So frenectomy was done with my scalpel initially. This is how it looked after 7. Once that was done, we planned a full thickness flap was raised and I could see the amount of screw exposed. So irrigation was done with Taxim. And then finally I did a laser decontamination with diode laser pulse at 940 nanometer. So that gives me a clear thing that now my Now my recipient bed is completely antibacterial, it's completely disinfected, and now I can place a graft. So that adherence rate increased. So current tissue graft was taken up from the palate and sutures were placed after placing it on the recipient's side. This is how it looked beautifully after the result. So what are the advantages of diode laser? First, you get a dry field surgery, you have reduced postoperative edema, there is destruction of your bacterial form, and there's decreased amount of scarring also. So that is one of the beauty of your laser. But what are the considerations? Laser is costly. Yes, you have soft tissue diode laser that will range between 2 to 5 lakhs. Specific training is required. You need to wear eyewear, and laser should not be reflected from the metal surface. Laser plume that comes out is hazardous, so you should always keep that high vacuum suction. So what are the advances in laser? You have one more thing that's called as Ferrari of laser, water plus laser. It's a hard tissue laser where you can perform all your procedures of your dental that you do with your air rotor with your laser. So patient will not have that drill thing. The people get scared of, but yes, that's quite expensive, between 40 to 50 lakhs. And next is a Pavio Wave. So it's a photodynamic disinfection system that utilizes non-toxic dye, that is photosensitizer, in combination with a low intensity laser to enable to release singlet oxygen molecule to destroy the bacteria. So to conclude, I would like to say laser offers you with access, precision, hemostasis, less pain, patient compliance, better operator and patient comfort. So it's more important for dental practitioners to become familiar with the principle and science of laser and its application in dentistry. So they say the laser is a brush for your painter, chisel for the sculptor, instrument for the physician, but not forgetting the ultimate healer. So these are my references. Thank you everyone for being so patiently listening to me as this is your online webinar. These are my personal details. You can get in touch with me and they're active on Instagram, and I do conduct a lot of laser courses and perio courses. So stay tuned with me on my social media. Thank you.